Senate Finance Committee will come to order. We have one bill before us, House File 3379, Senator Hoffman, and we have both Senator Hoffman and Senator Wickland here to present the bill, and perhaps go ahead.
Senator, Mr. Chair, and members, before you today is our program integrity bill. I'm going to keep my comments brief before our nonpartisan staff talk us through that bill, and also Senator Wickland. But there's one point I want to underscore, Mr. Chair, is that we are listening and we're taking feedback from members and the public. Before we heard the bill on Monday, we heard concerns about the provisions to eliminate remote supports. Because of the collaborative work of our two committees, the provision has been taken out of the bill. We also heard concerns about the changes to nursing home rates in the bill, and we want to thank Senator Pratt and Senator Utke for working with us in a bipartisan manner to come up with an amendment for today. I think will address the concern. People also raised concerns about the feasibility of implementing individual provider enrollment numbers, and we know that Senator Mohammed has continued to work on this provision. Thank you for that, and we'll probably have a proposed solution as well. And the other thing is, it's important, Mr. Chair, is things are moving. I sent to you a judicial order regarding the concern of continuity of care not being followed. That's something that we take as a priority. And I don't know how many times, if somebody was going back on YouTube or whatever it is and count how many times I said continuity of care, it might raise up there with how many times Senator Champion might have said expeditiously. And so we're good with that. But as we move forward with today's discussion, I just want to let you know that we remain, Senator Wickland and I remain committed to listening and working together regarding this. There's lots of work that needs to be done on this, but that's what this process is meant to be. So with that, Mr. Chair, Senator Wickland.
Go ahead, Senator Wickland.
Thank you, Mr. Chair. I'll just add, I just want to reinforce that this has been a very collaborative process between our two committees because the subject matter affects the jurisdictions of both of our committees. It's all very intertwined, and so we've worked together closely on coming up with this bill. The provisions in the bill have been reviewed and discussed in committee through session. We had discussions and bill presentations in my committee, and then the bills would also be heard in the Human Services Committee, and vice versa. We worked together closely, and to pull the provisions together into the final bill form took a great deal of effort from our nonpartisan staff and our Senate, our partisan staff. So I really want to just thank everybody for working together. This is a big effort, and it's a very important one because we know that addressing areas that relate to program integrity and strengthening our Medicaid services is a high priority for all of us. So I appreciate that, and I think we would just like to go to having a walkthrough of the spreadsheet, and then there is an index as well.
Okay. Mr. Raymond, welcome to the table.
Mr. Chair, members, thank you. I'm Kyle Raymond, fiscal staff to the Human Services Committee. So today I've been asked to do a walkthrough of the spreadsheet. So I'll start by saying what is in the Senate position reflects the A4 amendment. I'll start by going to, I'll start with the timestamp. The timestamp is May 7th, 4:33 p.m., just for page number and line references. I'll start on line 12, which shows the total net fiscal impact for all human services bill agencies. And in the 26-27 biennium, there's an overall reduction of just under 109 million in the 26-27 biennium, and then an increase in spending of 97.2 million in the tails. So most of that is general fund, which you can see on line 13. The general fund effect is a reduction of 110.2 million in the 26-27 biennium, and an increase in spending of 96.2 million in the tails. I'll just note that the general fund effect over the course of the 4 years would be negative 14.080 million. Moving next to lines 28 through 39, this includes the by agency and by fund breakdowns of the totals included in the bill. And with that, I'll go ahead and start with the proposals included, starting on line 59 with the Department of Human Services. The first proposal included is on line 62. This is a governor's proposal relating to transforming the human services system. So I'll mention that the governor's proposal included quite a few sub-proposals. So what's included in the Senate position is the state administered eligibility and processing study. There's a county state role study and proposal-wide management project. There's also some administrative resources for the entire proposal. So the net cost of the proposal, as reflected in the A4, is 10.7 million in the 26-27 biennium and just under 40.16 million in the tails. I'll also note with this one, there are 2 items that are included in the governor's position that were passed off the floor in the Human Services Supplemental Omnibus, and that is the Min Choices Assessment, and there's a version of the waiver case management study in that bill. I'll now move to page 2, line 102. This is a governor's proposal relating to making changes for market and receipt-based rates for disability and older adult services. So this proposal would be expected to reduce future expenditures by about 500,000 in the 26-27 biennium, and then just a reduction of just over 4.5 million in the tails. Moving next to line 11, this is a governor's proposal relating to enhancing program integrity and medical assistance, and this would have a cost of 24.3 million in the 26-27 biennium, and just over 46.6 million in the tails. Moving next to page 3. Next proposal included is on line 135. This is a governor's proposal relating to modernizing program and payment integrity safeguards. So that includes enhanced prepayment review, post-payment review, audit modernization, as well as some funding for AI, data integration, and workforce capacity. So this proposal is included and has an expected reduction in the 26-27 biennium of 165.2 million, and then in the tails has a cost of about just over 2.3 million. Moving now to page 4, line 157. This is a governor's proposal relating to uniform services standards implementation. The net effect of the proposal is a cost of 1.56 million in the first biennium and just under 1.5 million in the tails. A small portion of that is general fund. It's about 262,000 in the first biennium and 400,000 ongoing in the tails. The rest is state government special revenue fund expenses. Moving next to line 170, this is a governor's proposal where there were also multiple Senate files related to the same topic, billing and payment oversight for disability, older adult, and behavioral health services. So this bill includes, the DE includes a modified version of the governor's proposal. The net effect of the proposal is just over 2.5 million in the first biennium and a reduction of 4.7 million in the tails. So I'll just mention this includes HCBS provider accountability through documentation requirements, service delivery oversight, residential service staffing documentation, and expanded EDD verification. The next proposal that is included is on page 6. So now going to page 6, line 254. This is a governor's proposal related to enhancing program integrity and quality in nursing facility rates. So this includes some of the governor's proposal that would limit health insurance costs for nursing facilities, as well as would modify the quality-based payment limit. And the net effect of those two items would reduce future expected expenditures in the 26-27 biennium by just over $6.6 million. And then in the tails would be a reduction of just under $33.7 million. Moving next to page 8, line 256. This is governor's proposal related to enhancing program integrity, in integrated community support services, ICS. So this proposal, I'll note, there was, compared to Monday, there was just a staff omission on line 168, so that is added in, but that was correcting the error from Monday, and it does not represent an additional change to this proposal. So the net effect of the proposal is a cost of just over $2.8 million in the 26-27 biennium, and then a cost of just over $8.1 million in the tails. Moving next to line 278, this is from Senate File 3755, related to a repeal and redesign of HSS. Also includes requirements relating to posting comments for waiver and state plan amendments and prohibiting executive termination of MA benefits. So this has a cost of $199,000 in the 26-27 biennium and $466,000 in the tails. Moving next to line 285, so this is from Senate File 4551 relating to pre-award risk assessment activities. This proposal has a cost of $4.3 million in the 26-27 biennium and $9.8 million ongoing in the tails. Moving now to page 8, the next proposal included is on line 296 related to Senate File 4604 related to requiring compliance training for high-risk providers. There's a cost of just over $10 million related to this proposal in 26-27 and a $21.4 million cost in the tails. So that concludes the Department of Human Services. Now moving to the Department of Children, Youth, and Families. So the next proposal included is on line 323. This is related to Child Care Assistance Program, Program Integrity. This proposal has a cost of $3.3 million in the 26-27 biennium and $5.6 million in the tails ongoing. Now moving to page 9, the next proposal included is on line 340, which is funding for human services redesign, and has a cost of just over $2.2 million in the 26-27 biennium and just under $1.3 million in the tails. And finally, on line 346, this is a proposal related to what I mentioned earlier for DHS, for Senate File 4551. There's a cost to DCYF as well, related to the proposal being related to pre-award risk assessment activities. And this has a cost of just under, $1.352 million in the 26-27 biennium and just over $2.8 in the tails. And that concludes my remarks, Mr. Chair.
Thank you very much. Are there questions about the spreadsheet? Senator Pratt.
Thank you, Mr. Chair. Mr. Raymond, you skipped over line 137. You talked about the system modernization, but I'm looking at this 156 million savings, and can you explain in LW, which, and maybe you can explain what LW means as well.
Mr. Chair, Senator Pratt, so yes, this is part of what I mentioned on line 135, so specific to line 137. This is a medical assistance cost related to long-term care waivers. So as I understand it, this cost, specifically the 156.246 million, is related to expanded prepayment review, which would have the reason why the cost starts out higher and then goes down is because similar to what happened in the fall or I believe it was in December, there was a 2-week lag in the payments that went out to providers. So that creates a one-time reduction in expenditures for the state, which is represented in, I believe, fiscal year 2027. That totals 156.246. And I believe there may be some other items included within that line, but I think that's at least an explanation of why the cost is structured the way that it is.
Senator Pratt.
Thank you, Mr. Chair. And is there an assumed amount of fraud that's going to be, because what it looks like to me is that we're shifting these payments past the forecast period to create the appearance of a savings.
Mr. Raymond.
So, Mr. Chair, Senator Pratt, so I think for the 165, essentially, there is a one-time payment delay that does result in reduction to the state that does carry forward. However, I do think there are other savings attributable to a reduction in fraud, but I think if you're looking at specifically at that 156 number, then that would be attributable to the 2-week delay that would occur in payments that go beyond the high-risk providers that were subject to the 2-week delay in December. So essentially for that amount of money that would carry forward throughout the end of the biennium.
Senator Pratt, continue.
Thank you, Mr. Chair. Well, I served on the board of a nursing home and long-term care facility, and we routinely were waiting 18 or more months for reimbursement. And is this going to be kind of a permanent delay then for these long-term waivers on an ongoing basis? Because again, it seems like it's more than a 2-week delay. It seems like it's pushing it past the forecast period.
Mr. Raymond.
Mr. Chair, Senator Pratt, so this is slightly different than the lag for nursing facility rates, but so what this is the 2-week delay continues going forward. So each subsequent, relative to what would be assumed currently, every single week after the initial delay, there would be a subsequent 2-week delay. So it isn't necessarily a delay in rates akin to the 15 to 18-month delay for nursing facility rates. But it's just because the state, what is assumed in the forecast right now, the state would be one time paying them 2 weeks later. That would create the savings, but you're right that the subsequent payments would be 2-week delayed 2 weeks going forward.
Senator Pratt, continue.
Thank you, Mr. Chair. So just to be perfectly clear, providers will only be waiting 2 weeks. They won't be waiting months.
Mr. Chair, Senator Pratt, so that is correct, but then the reimbursement for the subsequent claims would be, each would be 2 weeks, so that would continue.
Further discussion?
I
If
think
not,
Senator Hoffman had something to say.
No, Mr. Chair, if it may, we all, and this happens a lot where we get, there's a confusion between the VBR, which is what established in 2017, which is the 15 to 18-month review, and then the prepayment on this is on the MA side of it. But it should not. That's why I shook my head when Mr. Raymond started to explain it. I was shaking my head yes. So I didn't need to add anything more to it, unless you want me to, quote some.
We're good.
Okay.
Mr. Chair.
Senator Pratt.
Thank you, Mr. Chair. And Mr. Raymond, would this have any impact on the reimbursements we get from the feds? Because my understanding then is that they're paying about 50%. Would that actually double the amount being delayed?
Mr. Chair, Senator Pratt, so essentially with the delay, that is how it works with medical assistance, that it would be double.
50-50.
Yeah, roughly. I mean, it varies. There's an FMAP that varies year to year, but overall, it can be thought of as roughly double. Yeah.
Senator Pratt.
And again, thank you, Mr. Chair. And just again, I wanted to be perfectly clear because I've already kind of forgotten. How much do we expect to save in fraud on this? What's the presumed fraud rate that's in this bucket and why we're delaying it an extra 2 weeks?
156 plus.
Mr. Vasso, go ahead.
Good morning, Mr. Chair and Senator Pratt. As I understand this governor's proposal, there is no assumption in here that there would be any recoveries, additional recoveries to anything in this proposal related to fraud. The primary effect of this proposal is what Mr. Raymond was discussing, which is the payment delay.
Senator Pratt and then Senator Mohammed.
Thank you, Mr. Chair. So if I understand Mr. Albrecht, there's no presumed fraud savings in this 156 million that we're delaying. But the whole point of this bill is fraud savings and program integrity. But this looks like it's more of a financial shift.
Mr. Chair.
Senator Wicklund.
Mr. Chair, Senator Pratt, I mean, the prepayment review is a program integrity process, and that's why they're implementing it, and it is something that is part of the corrective action plan that we are working with the federal government on. It's one way to add more assessment before payments are made. That's the point of it. It's not, the fact that it needs to be a 2-week delay is technical implementation of it, but that isn't the point of it. Does that make sense? I mean, the point of it is to do a prepayment review of claims before they're provided to the providers.
Keep going.
Thank you, Mr. Chair, and Senator Wicklund, and thank you. You know, we discussed that. I know we discussed that yesterday as well, and I certainly understand that. But the governor put on a delay in payments last fall, and I recall that didn't go very smoothly. And I'm kind of curious on, will we have that same impact here? Because it looks like we're not just covering the bad providers, we're hitting all the providers, not just the high risk.
Mr. Chair.
Senator Wicklund.
Mr. Chair, Senator Pratt, I think from learning from that experience, there is language in the bill that does add to the requirements that this prepayment review process needs to be phased in, and it requires more notification than was provided last year when the initial prepayment review was implemented on the 14 high-risk services.
Senator Hoffman.
And to add to that, there is language, and I don't remember if it's in our budget bill or if it's in our policy bill or if it's in this bill, but there's the difference is we require a 60-day notice before that prepayment review so providers are not caught off guard. But in addition to Senator Pratt's point, we got to be very careful here because at the end, it did not go so well. And a judge determined it didn't go so well. There are 6 people who died because it didn't go so well. So I'm very cautious about how we're doing this and what we're doing. But I think in this case, because we put in that 60-day notice requirement, and I can't remember, Senator Wicklund, if it's in this bill or if it's in it's in this bill. It's in this bill because I got 3 of them going out there. But that should offset that piece of it.
Senator Pratt, Senator Mohammed.
Mr. Chair, I was just going to say for the questions for Senator Pratt had, I think a lot of them, the agency should answer some of those questions. Just felt like more agency questions and not nonpartisan.
Okay.
Mr. Chair, I'm happy to have anybody that wants to come up and answer the questions.
Sure. Are there further questions right now? If not, let's continue if people have more questions later. Okay. Are we ready to have either Ms. Hoffman-Leachy or Mr. Monahan go through the index chart?
Yes, Mr. Chair, members, you should have a bill index in your packets. Ms. Hoffman-Leachy and I organized it a bit differently than indexes you may have seen in the past. We arranged it by topic for ease of the members understanding the related proposals, but we drafted the bill to match what we believe will be the format of the House file. So I'm going to start by reviewing the provisions having to do with billing and service delivery oversight. I'll just hit the highlights of the language that, or the proposals that are included. Oh, and one other thing I'll note, Ms. Hoffman, Litchi, and I had slightly different approaches to designating what originated as a governor's proposal. Anytime you see these codes, like in row 1, OP-40, that's a reference to a governor's proposal. So sometimes they're in the second column, sometimes they're in the fourth column. So sorry about that inconsistency. So the first proposal in this topic area requires the commissioner to conduct prepayment review of all submitted fee-for-service claims, provide 60-day notice prior to the review beginning, and requires the commissioner to phase in implementation. The next proposal authorizes the commissioner to conduct post-payment review to identify potential improper payments and seek recovery. The next proposal, also a governor's proposal, requires managed care plans to conduct prepayment review of all claims and to publish program integrity metrics. The next proposal is new to the DE before you today. It requires the Commissioner of Human Services to provide summary data to other managed care plans within 10 days of receiving a report from one managed care plan that the plan has reason to believe fraud was committed under the medical assistance program. The next proposal is also new to the, delete everything in front of you today. It provides that a managed care organization is not required to include a provider in a network before approving the provider's credentials. The next proposal is a governor's proposal requiring the commissioner to utilize both prepayment and post-payment review systems. Clarifies that paying a claim after prepayment review does not prohibit the commissioner from completing post-payment review of the same claim. Does not prohibit the commissioner from taking any other administrative action or from seeking future recovery for an improper payment. The next proposal is also new in the DE before you today. It requires a license holder providing remote overnight supervision in a community residential setting to ensure that any third-party monitoring company the license holder contracts with maintains an appropriate staff ratio to ensure that the maximum permissible response times are met. Next proposal is a governor's proposal requiring the commissioner to grant providers limited access to a person's support plan in the min-choice assessment system in order to document the provider's understanding of the support plan and their agreement to deliver the services as outlined in the plan. The next proposal is from Senator Mohammed. It requires all individuals providing direct care authorized under a disability waiver to enroll in MA as an individual provider and have a unique provider identifier, and specifies requirements to be included in the documentation and the claims. The next proposal is the governor's proposal. It clarifies that HCBS providers may not use medical assistance revenue to pay for room and board, including any associated housing costs. The next proposal is the governor's proposal. It limits the allowable cost of health insurance provided by nursing facilities to its employees. Another governor's proposal modifies the total care-related payment rate limit used to calculate nursing facility reimbursement rates. Another proposal, also a governor's proposal, replaces the existing ICS daily rate with a 15-minute unit rate. Another proposal, also from the governor, establishes direct care staffing documentation requirements for residential services provided under the disability waivers and the elderly waiver. Next proposal is also governor's proposal. It limits administrative fees for market and receipt-based services provided under the disability waivers and requires a study of market-based rates and recommendations to the legislature. And finally, under this general topic area, there's a proposal to make technical changes related to EIDBI, clarifying changes regarding the meaning of clinical supervision and clarifying who may provide observation and direction under the program and specifies documentation requirements.
Mr. Chair.
Go ahead.
The next grouping of sections all relate to children, youth, and families, and they are both contained within Article 7 of the Delete Everything Amendment. The first proposal is from Senate File 4551 from Senator Utke, and it requires certain documentation from any provider, vendor, or individual that is seeking to enroll, become licensed, receive grant money, or register in any program administered by the Commissioner of Children, Youth, and Families. And the second proposal is a governor's proposal, and it requires all providers who receive child care assistance payments to complete compliance training.
Mr. Chair, members, the next major proposal has to do with electronic visit verification. This is a combination of 3 different proposals, the vast majority of which is a governor's proposal, to modify the requirements of electronic visit verification, expand the services subject to electronic visit verification. It authorizes the commissioner to exempt service components or service settings that might otherwise be subject to EVV, clarifies the option available to providers to comply with EVV, specifies data element requirements, clarifies provider responsibilities, and specifies the responsibilities of a third-party vendor if a provider chooses not to use the state-provided system.
Mr. Chair, the next proposals all relate to human services administrative reform. The first proposal is from Senate File 4969, authored by Senator Rasmussen, and it requires the Commissioner of Management and Budget to include the forecasted costs of each covered service provided under medical assistance in the forecast and to submit a report to the legislature that includes that information. The next proposal is the governor's proposal and clarifies that the Commissioner of Human Services may administer specific duties related to determining medical assistance eligibility on behalf of county agency administrations. The next proposal is also a governor's proposal, and it directs the Commissioner of Human Services to assess transferring the administration of medical assistance eligibility functions from the counties to the Commissioner. The next proposal is a governor's proposal as with changes that were accepted in the joint hearing on Monday, and it directs the Commissioners of Human Services and Children, Youth, and Families to conduct a study to assess and recommend improvements to the roles and responsibilities of the departments, the counties, and Minnesota's tribal nations. And the last proposal within this group directs the Commissioner of Human Services to contract with an external vendor to continue and complete the project that was initiated under Executive Order 25-10, Section 1, Paragraph G, and requires the Commissioner to provide reports. The next grouping of proposals relate to licensing and background studies. The first proposal is a new proposal that was accepted by the Joint Committee on Monday, and it provides that a license issued pursuant to a change of ownership is not subject to any moratorium, provided that the change of ownership does not result in an increase in licensed capacity or service scope. The next proposal is a governor's proposal, and it modifies the definition of individual who is related to include cousins and those related by marriage, and allows programs to operate under the previous definition if that program was initially licensed prior to July 1st of this year. The next proposal is a governor's proposal, and it removes a loophole that allowed a change of ownership to occur without notifying the Commissioner of Human Services. The next proposal is also a governor's proposal, and it modifies who must undergo background studies and also adds provider types to the prohibition on providing services pending background study results. The next proposal is also a governor's proposal, and it imposes a new 245D licensing moratorium for both the initial licenses to provide ICS services as well as license changes to add ICS services to an existing license. It also provides for limited exceptions to the ICS moratorium, imposes a moratorium on approving new ICS service settings, and provides for limited exceptions to the setting approval moratorium. The next proposal is new to the delete everything, and it was accepted in the joint committee hearing on Monday. And it provides that the Commissioner of Human Services is not authorized to deny a change of ownership license, a temporary change of ownership license, or a temporary transitional license that is otherwise permissible. And finally, the last proposal is also a new proposal within the Delete Everything Amendment. It reorganizes and modifies the ability of the Commissioner of Human Services to impose a discretionary temporary licensing moratorium. It describes the information that needs to support a determination of exceptional growth in applications for licensure or requests to add new services, and requires the Commissioner to publish an explanation of the processes and criteria used to grant exceptions to the temporary moratorium.
Mr. Chair, members, the next group of proposals have to do with medical assistance provider enrollment. The first group of sections includes a recodification of the provider enrollment requirements. So it looks like it's all new language, but the language only includes the following 4 policy changes. First, authorizing the Commissioner to perform pre-enrollment risk assessments. Second, authorizing the Commissioner to terminate MA enrollment if an enrolled provider has not billed medical assistance during any 12-month period. 3, requiring mandatory compliance training for providers of high-risk services. And finally, requiring all individuals providing direct care who are employees of a provider type designated as high risk to have a unique provider identifier. The next proposal is from Senator Utke. It requires certain documentation from any provider, vendor, or individual seeking to enroll, become licensed, receive grants, or register in any program administered by the Commissioner of Human Services. The next proposal is a governor's proposal authorizing the Commissioner of Human Services access to records and documents of enrolled medical assistance providers to verify information, to verify the accuracy of any information submitted by the vendor to the Commissioner, determine compliance with service delivery and billing requirements, and to determine compliance with other applicable laws and rules. The next proposal is from a Senator Mohammed bill. It requires an applicant or license holder who elects to receive publicly funded reimbursement for providing high-risk services under its license to disclose to the Commissioner of Human Services whether the applicant or the license holder received assistance in preparing the application or accompanying materials from a third party. The next proposal, also from Senator Mohammed, requires the Commissioner to establish an HCBS early and often licensor and compliance team to assist HCBS license applicants understand licensing requirements and provide newly licensed providers with technical assistance to comply with licensing requirements. And finally, in this theme, another proposal from Senator Mohammed requires the Commissioner to establish an HCBS provider support and technical assistance team to provide technical assistance and education to all HCBS providers and to act as a liaison between providers and the various administrations and offices within the Department of Human Services responsible for regulating and overseeing the licensing, service delivery, and billing of HCBS services.
Mr. Chair, members of the committee, the next grouping of sections all relate to sanctions within the medical assistance program. The first proposal is from 4 separate places. From Senate File 4267, which is a recodification of Section 256B.04, which is the medical assistance sanction statute. There's also language included from the A18 amendment from Senate File 4222. There's also modified language from Senate File 4783, authored by Senator Utke, and there was also additional changes that were accepted in the joint committee hearing on Monday. So this proposal recodifies the medical assistance sanctions section, and in addition to the recodification includes certain policy changes. Those are defining fraud in Chapter 256B and including a reference to illegal remunerations, clarifying that a payment withhold is temporary, requiring additional information in the notice that is provided by the commissioner when withholding payments, providing that abuse for the purposes of this section does not include billing errors that result in unintended overcharges, providing that the commissioner may obtain monetary recovery for an overpayment as defined by federal law, and providing that the commissioner may seek the recovery for investigative costs from an individual or entity that violates the False Claims Act. The next proposal is a governor's proposal, and it allows the Department of Human Services to collect on multiple surety bonds, requires that surety bonds must be purchased new annually, and requires any action to obtain monetary recovery or sanctions from a surety bond to occur within 6 years. The next proposal is new to the Delete Everything Amendment. It was accepted in the Joint Committee, and it requires that the Commissioner of Human Services to release the amount of withheld or reduced payments if the individual or entity posts a surety bond in an amount equal to the greater of the amount of the withheld or reduced payments or the amount of the risk exposure. This proposal also allows the commissioner to require provider compliance training for any individual or owner that posts a bond under this section, and provides a timeline of when the commissioner must release withheld or reduced payments, and also makes conforming changes. The next proposal is from Senate File 4222, the A18 amendment, and it allows an individual or entity that receives notice of a payment withhold to request an appeal. It requires the Commissioner of Human Services to refer the appeal request to the Office of Administrative Hearings, and provides that the burden of proof is limited to whether the Commissioner can establish there is a credible allegation of fraud. This proposal also requires the Commissioner to provide notice to the individual or entity when the appeal process is complete. The next proposal is a governor's proposal, and it allows the Commissioner of Human Services to use the remittance advice process as the notice to a vendor or provider when seeking monetary recovery of certain claims. And then the next grouping of sections are miscellaneous, and they are both contained within Article 8 of the Delete Everything Amendment. The first proposal removes substantial from the requirement that the Commissioner of Human Services cannot implement any substantial changes to a grant funding formula without first providing a report to the legislature. And that language came from Senate File 4672, authored by Senator Wickland. And the second proposal within this grouping is from the A18 amendment to Senate File 4222, and it directs the Commissioner of Human Services to provide statutory language to the legislature by December 1st of this year that codifies the Department of Human Services Office of the Inspector General. The next grouping of proposals relate to non-medical assistance human services sanctions. The first proposal is a governor's proposal, and for the purposes of Section 245.095, which is the sanction section not unrelated to medical assistance, it defines convicted and fraud. It moves the definition of credible allegation of fraud into the definition subdivision and clarifies the definition of excluded. The next proposal is also a governor's proposal, and it expands the authority of the Commissioner of Human Services under Section 245.095 to stop payments when a license is suspended or revoked, when there is a criminal conviction of fraud, and when there is a background study disqualification. And the final proposal within this topic area is also a governor's proposal, and it allows the Commissioner of Human Services to suspend a license if there is a related ongoing investigation or judicial proceeding. And finally, Mr. Chair and committee members, the last grouping of sections are from our governor's proposal, and they relate to the Uniform Service Standards proposal. They require services to be licensed by the Commissioner of Human Services that are currently certified, and they also make technical and conforming changes. Thank you, Mr. Chair.
Thank you both for a thorough walkthrough.
No, you don't.
Are there questions from the committee? If not, do we want to move forward with the adoption of, Senator Pratt?
I guess I had one question. I wanted to go back to page 2 of the index, Article 5, Section 41, limits the allowable cost of health insurance provided by nursing facilities. And, you know, we've been talking about staffing shortages for a long, long time. And we're asking these people to do a job that's hard to hire for. We've put additional requirements, you know, as I've talked about, on the cash flow of some of these providers, and insurance becomes one of those competitive advantages, maybe, so to speak, where they can offer benefits that will attract someone to these jobs. And I'm wondering if we can go back and maybe talk about what that limit looks like.
Senator Wicklund, Senator Hoffman?
It's my bill, Mr. Chair, and it was a governor's bill that, if you look at the index, it's Senate File 5042. So if it's specifically pertaining, if the good senator from Prior Lake, then I would request that somebody from the Department of Human Services come up here, because it specifically comes from the governor's bill. So, and I'm getting a shake of the head, so.
Could we have
I'll
somebody
step
from
aside.
DHS come up and discuss? Good morning, Ms. Bailey. Welcome to the committee, and please go ahead.
Good morning, Chair members. Elise Bailey, Budget Director at the Department of Human Services. This provision was in the governor's budget, and it is a mechanism to ensure that we have kind of limits in the growth in costs related to the rates paid for nursing facilities. Since we implemented the value-based reimbursement method for nursing facilities, prior to that, there were limits to the growth in health insurance. And since we implemented VBR, the state essentially pays the full cost that the nursing home incurs. And we've seen throughout this time period that some nursing homes don't get insurance plans that are kind of reasonable. So the state takes on the full cost of risk for the nursing homes. It's just essentially a pass-through. So what this proposal does is it just basically limits the per employee amount that would be reimbursed through the value-based reimbursement to a level, I think, similar to what the CGIP, the state plan, the state employee plan pays per employee, which is a pretty high amount per employee.
Senator Pratt.
Thank you, Mr. Chair. Well, you know, I mean, I'm just looking at this and I'm thinking, if someone was on a family plan, they could only do, you know, a little over 1,000 a month, which, as I've seen it in a lot of plans that, you know, both in the private sector and the public sector is easy to surpass, especially when you're trying to give good plans to people who are exposed to various viruses and different things. The other concern I have is writing in a hard dollar amount here, because it doesn't take into account the rising cost of insurance over time. And I'm trying to figure out how this fits into a fraud reduction slash program integrity bill, have we found fraud in this part of the program?
Ms. Bailey?
Chair Marty, Senator Pratt, essentially, I don't know how to answer the question about fraud, but we are seeing some nursing homes choosing to do self-insure plans where they're not trying to get plans that have a reasonable amount of cost. And so this proposal would set it at that amount, but then it would increase over time according to CPI. So there is growth over time. The intention isn't to hold it flat because we know health insurance costs raise over time.
Senator Pratt?
Thank you, Mr. Chair, but to the testifier, I'm sorry, I forgot your name already. What was it?
Director Bailey.
Thank you, Ms. Bailey. We've seen the cost of health insurance exceed the CPI. Isn't that correct? And so wouldn't our employees fall behind if that were our measure?
Ms. Bailey?
Chair Marty, Senator Pratt, I think the department would be happy to provide technical assistance to this provision. We basically were intending to set it at a reasonable amount, a high amount, and then index it up over time. And if CPI isn't the correct measure to index it up over time, I think, we would be happy to provide technical assistance to the committee on that. But our intention was to index it up over time according to increase in costs.
Senator Pratt?
Well, thank you, Mr. Chair. And Ms. Bailey, how do you determine what's reasonable?
Ms. Bailey?
Chair Marty, Senator Pratt, that's a great question. We were intending to set based on a reasonable amount that we all, under the state insurance plan, that seemed like a reasonable measure to set it at, but, it is a subjective, I guess, assessment.
And I'm told that there is an amendment coming that will be removing this section anyway?
Yes.
Okay.
So then I'll hold off.
Are we ready to adopt the Sir Draheim, I'm sorry, I didn't see your hand up.
Thank you, Chair. I have the A8 that I think will help address some of the questions Senator Pratt had.
Thank you, Senator Draheim. Yes, that's
It's not
accurate. Should we start by, Senator Wickland, you want to offer the A4?
Mr. Chair, I'd like to offer the A4 amendment so that we can work from that on adding other amendments.
And that's what we've been walking through effectively. So is there any discussion on the A4 amendment? If not, all those in favor say aye.
Aye.
Aye. Opposed? Motion prevails. Now, other amendments. Senator Hoffman or Wickland, you have an order you want to go through in these?
I'm gonna yield, since this is in committee, I'm gonna yield to Senator Wickland on that one.
Senator
Mr.
Wickland,
Chair,
go
I
ahead.
don't
What's
have
next?
I don't have other amendments that I'm offering personally, but if Senator Mohammed, I think, has.
Should we start with Senator Draheim, since we've been talking about that one already?
We can do that.
Senator Draheim, you said the A8, I believe, is the one we were,
Yes, correct.
that's in the packets. Could you explain the amendment? And
Yeah, this deletes section 10, I think on page 19, and then section 41, 42 on page 183 and 184, and then on page 202, section 1. And I believe this is a agreement between Senator Wickland and Senator Utke, the pre-award risk assessment, or what I view as the cuts to the nursing homes, needs a little more work relating to capping the insurance costs.
Senator Wickland?
Mr. Chair, the pre-award, as Senator Drahan mentioned, the pre-award risk assessment, that was a bill that Senator Utke brought forward and we included, and it was determined that the cost was significantly more than we were expecting, and so it's just not something we can continue to carry in this bill. And then after negotiating the two nursing home provisions, after discussions about concerns about the insurance, and then the other one, which relates to rates, I believe, that it would be acceptable to remove those from the bill.
Thank you. Quick question for either Mr. Raymond or Mr. Vestal. Does this have a cost on the spreadsheet?
Mr. Chair, so it's not currently included in the spreadsheet
Okay.
that we walked through.
You had prepared the spreadsheet, assuming this might occur. Thank you. Is there further discussion on the A8 amendment? If not, all those in favor say aye.
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 Opposed? Motion prevails. Other amendments, Senator, A7 amendment, is that Senator Mohammed, I believe?
That's me, Mr. Chair. I'd like to offer the A7 amendment.
Okay, it's in the packets.
I can talk about it. Okay. So the A7 amendment does four things, Mr. Chair. It deletes the individual provider ID requirement for providers. It directs DHS to develop and implement system changes to integrate data collected through EVV with Medicaid Management Information System. The data collected through EVV must be used as part of the DHS processes for validating claims for services subject to EVV. And it also requires that DHS manage care plans and county-based purchasing plans to integrate data with EVV as well by January 2027. There were many concerns about the practicality of requiring individual provider IDs for all providers. And this is something we heard about through session as we've been navigating this bill. I'm happy that DHS has helped provide an alternative solution by connecting the EVV to the Medicaid billing system. And so this, I think, is a compromised language.
Thank you. Senator Wicklund, any comments?
Mr. Chair, I appreciate that Senator Mohammed has worked really diligently with the department and with providers to understand, the impacts of bringing forward the original bill. And I appreciate her that she's been able to find a compromise that we'll be able to move forward with in a more effective way. So thank you.
Senator Pratt.
Thank you. Mr. Chair, and to whoever wants to answer this, I'm kind of curious what the problem is with the individual provider number proposal, and will this impact our ability to identify fraudulent charges at all?
Do you want to speak to it?
Senator Mohammed.
I mean, I think for providers, this felt like it was something that was impossible for them to do. For the agency, I think they can speak to some of their concerns if they want to. For me, my intention of bringing this bill forward early in the session was to provide a space for providers to prove their work while not being accused of fraud. And for people who are accessing these services, for them to have accountability and some sort of measurement, so.
Senator Wicklund.
Mr. Chair, Senator Pratt, this, as we move forward in session, it was becoming clear that for DHS to implement this for the many providers, it would be a capacity issue for them and would require a lot of additional FTEs to be able to implement because of the work required to be able to create these for so many more providers than they do today.
Senator Pratt.
Thank you, Mr. Chair, and Senator Wicklund and Senator Mohammed. I guess, going back to my banking background, we had to have a know your customer, we often called it KYC proposal, where we had to be able to validate everybody who was here. It seemed to me that providing this individual provider number was a way of doing that. I guess we'll be using the EIN tax number then as a unique identifier for these folks and making sure that they do in fact have EINs and aren't working on personal social security numbers or individual TINs?
Senator Wicklund.
Mr. Chair, Senator Pratt, I would need somebody from the department to be able to comment on how this is different from what is done today. I mean, these providers, there are people who are providing services today. And this was
Welcome back,
to
Ms. Bailey.
add.
Thank you, Chair Marty and Senator Pratt. Currently, when we enroll providers, we do collect the EIN tax information. What this would have done was to add all of the workers on the claim. So not just the owner of the entity, but the workers. That would have required us to have thousands and thousands and thousands of more enrolled providers. And the compromise with Senator Mohammed essentially does the same thing without having to go through enrollment, because I think the intention is to really know who is providing the service, who is the human being in the person's home providing that service at that time that the claim is being billed at. So with EVV, we'll have an electronic method where they're checking in who they are, who they're serving, where they're at, get the GPS, timestamp and everything. And then connecting that on the back end to the claim that's being submitted. So it essentially will do the same thing without having, using technology versus needing, essentially a few hundred FTEs at DHS to do all the paperwork the other route.
Further discussion, Senator Pratt.
Thank you, Mr. Chair and Ms. Bailey. So I guess I'm kind of curious because I have to have an individual identifier for each of those people doing EVV in order to be able to track exactly what they're doing. And do all of those. So I guess I'm trying to figure out how this is different, because you still got to have a unique identifier so you know the person that's providing that service as well. And so whether the identifier is the individual provider number or the identifier is some other way, you still have to come up with that identifier. So what identifier are you using that already exists for that individual person or provider?
Ms. Bailey.
Chair Marty, Senator Pratt, my understanding is doing it through the original version of the bill. It wasn't just creating a unique identifier. It was going through all of the steps of enrolling that worker as a provider versus enrolling the entity as the provider and then having the unique identifier in the EVV data. So it wasn't necessarily the issue of creating a unique identifier. It's all of the work that it takes to actually enroll an individual provider that would require a lot of resources at the department.
Senator Mohammed.
It would essentially do a similar thing, except it's more cost effective and it's not so much staff that they have to hire because money's tight.
Further discussion on the A7 amendment. If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. The A9 amendment, is that also yours, Senator Mohammed?
That's mine, Mr. Chair. The A9 amendment is more of a funding mechanism because our early opt-in program is something we were codifying into law. Costs us a lot of money, and I will have Kyle go through the mechanism of the funding that we canceled from the last biennium and that we're putting into this.
And Mr. Raymond, my notes indicate it's largely technical, but you could explain it.
Yes, Mr. Chair, Senator Mohammed, yes, so what is happening in the amendment, and I don't have a version in front of me for line purposes. Oh, thank you. So in the Human Services Bill enacted last year, there were two separate there was funding provided for the early and often program and also for HCBS provider licensing compliance education. So in the underlying bill, this funds, from Senate File 4604, this funds those same activities. So essentially, what is happening in this amendment is the funding that was provided for the similar purpose last year is being reduced, and then it's being funded in the underlying bill.
Any further discussion on the A9 amendment? If not, all those in favor say aye.
Aye.
Opposed?
Aye.
Motion prevails. Is there further discussion, further amendments? Senator Pratt.
Thank you, Mr. Chair. I have the A5 amendment.
Senator Pratt has the A5 amendment, which I do not believe is in the packet, so we'll have that distributed.
Sorry, Mr. Chair, I got it a little late this morning to share with the authors.
Can you?
You want to explain the A5 amendment, Senator Pratt?
Thank you, Mr. Chair, members. What this does is basically adds language that says there's nothing that prohibits a utilization review or a prior authorization review specific for those 14 high-risk providers. And then as that list changes over time, this requirement would fluctuate with those that we've deemed to be high risk. I think there's an additional, a little bit of extra work that needs to be done on this, Mr. Chair, to make sure that we're not hitting everybody, but really targeting who we want. And I've talked to the chairs about that, but to be able to at least start with this as we continue the discussion on preventing fraud, particularly in these high-risk areas.
Senator Hoffman or Wicklund?
Mr. Chair and members, I appreciate Senator Pratt did talk to Senator Wickland and myself this morning. The fact is he brought this up the other day and he's redefining and trying to get it right. I think it's worthy of the conversation because you don't, that prior authorization, let's talk about prior authorization, right? No, I don't want to talk about prior authorization. I think he's on the right path here. We just gotta work on it until we get it right, so.
Senator Wicklund?
Mr. Chair, Senator Pratt did talk to me about this. I didn't see the language till just a few minutes ago, and when you showed it to me, I didn't realize, I guess one thing I didn't realize is that it's written to a part of statute that's kind of outside of what we've been talking about, 62M, and I just want to make sure that we vet this and make sure it doesn't have an impact on any other aspects of what we allow health plans to do, and that we aren't inadvertently adding some barrier or allowing insurance plans to impose restrictions that we as policymakers didn't intend. I mean, I understand that we want them to have the ability to do work to address fraud and program integrity, and I think they have tools to do that today, but we also don't want them to start imposing this in a way that is more of a, maybe a cost saver for them and not tied directly to addressing fraud.
Mr. Chair.
Senator Pratt?
Thank you, Mr. Chair. And Senator Wickland, what I'd like to do is be able to, and what I had originally intended and wasn't drafted with this in it, was to say that there are standard costs that we've identified and really trying to attack those where we've exceeded those standard costs. Those are the pieces that I'd like to continue to work on. But specifically trying to, limiting them to the high risk providers as we've described under that section of law on the back page is specifically what I'm interested in doing, because that's where we're seeing the problem. And we may, right, as someone who used to run a fraud team, we'll find that fraud changes over time. There may be new schemes that come in attacking services that hadn't been attacked before. That list may change over time, and I think we want to have the ability to be fluid with how fraud changes.
Senator Wickland?
Mr. Chair, Senator Pratt, I don't disagree with that, but I do want to make sure that we're all aware that, because a provider or a service is designated as high risk, that doesn't necessarily mean that, you know, all the providers within it are high-risk providers. It's meant to be a definition, and it comes from a federal definition. And so I just want to make sure that we're conscious of how this might get used, this ability might get used, and I'm happy to keep working with you on that to make sure we are getting at the issues that you are raising.
So Senator Wickland, on this amendment at this time, are you interested in putting it on and discussing it, or discussing it and not putting it on?
We can add it today. I do think it needs more, and so we will continue to have that discussion about what else needs to be added, and if we are coming across some complexity that is going to impact the way we have implemented our medical assistance program, then I guess I reserve the right to, you know, come back to you, Senator Pratt, and just say it needs to be fully vetted in a process would have to be next year.
Senator Mohammed,
Senator Pratt, I was curious if this has been a language that's been introduced as a standalone bill? Like, has this language come?
Senator Pratt.
Mr. Chair and Senator Mohammed, no, this came to me as a concern with the
Mr. Chair,
Senator Mohammed.
I'm curious if maybe the Commerce Department or agency committee would want to see this language.
Send it.
Somebody from Commerce or HHS, or you're saying from the departments you want to
Oh,
know?
no, from the committee. Like maybe Senator Klein might want to see this language considering it hasn't been introduced as a standalone bill.
Senator Hoffman or Wickland, do you have, Senator Wickland, you're on Commerce Committee.
Just on, Mr. Chair, Senator Mohammed, based on high-level review of it, it seems like something that would be of interest to the Commerce Committee, and it would have been of interest to the HHS Committee, because if we're going to impact the prior authorization processes for things that are under the medical assistance program, it would be something that we'd want to take a look at, so.
Final follow-up, I'm curious if this language gets on today. I'm not saying one way or the other. Would that mean for the purposes of process, the bill would have to go to Commerce?
Senator Mohammed, if we put this on here, I presume that's going to be in the bill, and people should talk Commerce Committee Chair and members, and the authors here can also move to remove it if they feel uncomfortable with it after they take a look at it.
Mr. Chair.
Go ahead.
Yeah, you got a couple stops that we can fix this. You got a judiciary stop, plus you got the floor. And when we present, you know, this House file is my House file, so when we do it on the floor, Senator Wickland and Senator Pratt, if there is an agreement, then we'll move to take it out. It's not the first time ever that we've done something like that. Matter of fact, I believe this committee, the committee that I chair, we always do the best we can to get stuff across the finish line. But sometimes, and Mr. Raymond will attest to this, that, you know, I say if the bill doesn't have a fiscal note attached to it, it is just going to automatically come out when we come to see you. Matter of fact, I've done that 3 years in a row. So it's a work in progress. I'm glad to see other people getting involved in human services work. So I think it's worth the conversations that Senator Wickland and Senator Pratt are going to have between now and a couple stops later. But if you want to send it to Commerce, go ahead. I'm kidding.
I believe Mr. Hudawa is in the room if Commerce Committee staff wants to comment.
Thank you, Mr. Chair, members of the committee. Yes, this amendment is something that the Commerce Committee would typically see. HMOs are enforced by the Department of Health, but all other health plans that would be covered under this Chapter 62M are regulated by the Department of Commerce.
Senator Wickland and Hoffman, your desires.
Mr. Chair and members, I stated it. I think that Senator Wickland and Senator Pratt, we got a couple stops, work on it if that means talking to people. This is how the process, in my mind, works well. There's an idea, there's a concern. Go work it out. We got 2 stops. I'm okay. I'm a little more flexible than some others in
With
front
that,
of
is there
your
further
committee.
discussion on the A5 amendment of Senator Pratt? All those in favor say aye.
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 Opposed? Motion prevails. Further discussion, further amendments? Senator Pratt.
Thank you, Mr. Chair. Senator Hoffman, you mentioned a stop in judiciary. Can you talk a little bit about that? Because I know there are some pieces here around felony for illegal kickbacks and certain things. You've not been to judiciary, you're planning to go to judiciary. Are we moving this to the floor or back to judiciary?
I believe we are moving this to the floor, but that judiciary is scheduling a hearing on parts of the bill that fall within their jurisdiction, and they know they need to review it, but want the bill to keep moving because of the very limited time available. That's my understanding. Is that what you're understanding, authors?
It's not my understanding, Mr.
Yes,
Chair.
yeah.
Is it your understanding?
Mr. Chair, we have, I believe it will be occurring on Monday. Nonpartisan staff is working to identify the items in the bill that would need to be seen in the Judiciary Committee. Actually, some of the items in here that are items that Judiciary needs to see have already been heard in Judiciary. I had a bill that I presented a couple weeks ago that contained some of the background studies provisions and other items that we had already identified were likely to be in the bill, so we had them heard. We didn't have the bill put together at that time a couple weeks ago, so we needed to make sure that we knew exactly what items need to be reviewed in the Judiciary Committee. And part of the issue this year has been that we didn't receive the language from some of the governor's proposals until very late, and so it was difficult to get everything moved through the Judiciary Committee within deadlines.
And so, in other words, yes, judiciary's heard most of the provisions, but there were a few things I'm told related to due process that they still haven't looked at, and they still wish to do that.
Yes,
And they'll do that, you said, on Monday, you think? Okay.
that was the last I heard, so.
Okay, Senator Pratt.
Thank you, Mr. Chair. There's just one other section on this bill I wanted to talk about, and that was an appropriation for a market study on home and community-based services. As I look at this,
Which one is that?
DHS is asking for, I think it was $2 million to conduct a study on themselves. And shouldn't this be something that they're able to do on their own, or why do we need $2 million to do a study that they should be doing as part of their normal procedures? It's page 197, section 45.
That's a provider cost study. That should happen anyway. That's the provider cost study, I think. Right, Kyle, I think that's the provider cost study that shows the market rate on transitional services, right? Can you, I'll let you continue to answer. That's a governor's provision.
Mr. Raymond.
Mr. Chair, Senator Pratt, apologies for the delay. I had to find the appropriate writer. So it is there's a rider for that language that's $500,000 in fiscal year '27, and then for that study, and then it's extended through, it's a one-time appropriation that's extended through the end of fiscal year 2028.
So it's 500,000, not 2 million?
Correct.
Okay.
Further discussion?
Well, Mr.
Senator
Chair, I
Pratt.
think it still begs the question, why are we appropriating 500,000 to DHS to do a study that they should have been doing all along and should be doing internally?
Mr. Chair, that is a governor's provision, and again, we didn't get the governor's bill, as Senator Wickland has alluded, until really late in the game. I think this is a market rate study, but rather than me saying it's a market rate study, maybe we should get an answer from somebody from the governor's office that can do that, because he's highlighting some things that are all of a sudden like, wait a minute, this bill does need to go to judiciary. So, is there somebody here that could answer that on behalf of the governor? Am I correct in the assumption that this is a governor's provision?
Ms. Bailey is coming forward.
And we do market rate studies, Mr. Chair, right? I need clarification on this one as well.
Director Bailey, welcome back.
Thank you, Chair Marty, Senator Pratt. Yes, this provision is in the governor's budget and is one area that we've assessed our, in the long-term services and supports area of our Medicaid program, where we have services that are set based on market rate, which means the provider and the lead agency, the counties, are negotiating the rates, and we don't have a standardized process for setting what is an appropriate rate for each service. This provision is saying we need to study these and see if we could come up with a standardized method for setting rates so that we're effectively paying providers for the cost of the services, but not overpaying them or underpaying them, frankly. Why we need the money for it is because the department has a limited budget. Our admin budget is 2% of our entire budget. And so something like this, we need, an appropriation to conduct.
Senator Pratt.
Thank you, Mr. Chair, and Ms. Bailey, while I've got you, there's also, I think the 2 million I was thinking of was directed towards the evaluation of DHS structure and processes, and shouldn't that be part of your standard operating procedures to go through and evaluate whether or not you've got the right structure and effective controls in place? We've been talking about effective controls going on for 5 years.
Director Bailey.
Chair Marty, Senator Pratt, I believe the $2 million study is a study to get an external contractor to conduct an evaluation of how we conduct eligibility in the state. So it is around thinking about what the roles and responsibilities of the state should be in eligibility processing and what the roles and responsibilities should be of the county, and defining what a next kind of phase of Minnesota's Medicaid program should be that would more effectively meet the needs of Minnesotans. So that's what it is. It's looking at how other states conduct eligibility. We're one of 10 states that has a state supervised county administered program. And we really want to kind of go back to the drawing board in consultation with counties to kind of assess is that the right way to structure the system.
Senator Pratt.
Thank you, Mr. Chair. And how did you determine 2 million?
Director.
Chair Marty, Senator Pratt, just based on other studies we've done in the past that were more expansive, this one will require assessing what are all the roles that the counties do and how are they financing those roles, and what are all the roles that the state does, because we do some functions of eligibility, and then assessing how other states conduct eligibility. So it's a pretty expansive study because it requires us to collect information that we don't have, such as how do the counties even finance these roles? Some roles are kind of not cut and dry. People in the smaller counties may be doing multiple different functions. And if we were to just propose, hey, let's take this all to the state, we would be kind of missing information that we would need to assess on what would be the impacts to the local government. So it's a pretty expansive study.
Senator Pratt.
Thank you, Mr. Chair. As the oversight agency, shouldn't you be aware of how counties are financing these programs already?
I think we have 87 different counties doing things different ways, and I frankly hope DHS doesn't have people who are trying to figure out how each county does this. I think the whole point of this is we're an outlier among states, that we do it by the counties, and should some of this be done by the state is a major change that I think could save significant funds, but that's what the point of the study's for.
And Mr. Chair, I don't disagree, but my question is, shouldn't the agency already know how these are being funded since they're the oversight agency? I mean, this has been in place for, you know, decades, and that was their role. I understand that, you know, we might want to go back and look at how other states are doing it and get better ideas, but $2 million to internally restructure or to figure out what we should already know, what the oversight agency should already know, seems to be a little bit of a waste of money.
Director Bailey.
Chair Marty, Senator Pratt, as the oversight agency, we know what functions are being done. Our role is to ensure that, you know, the requirements of the program are conducted as such. Our role is not to know how local taxes fund FTEs at the department or at each county. So there's a lot of information that we don't know because it doesn't flow through the state. And I think we've heard from our counties over time that, you know, in order to meet the expectations of conducting eligibility and all the other human services functions that they have, the complexity that's grown over time, they've had to add resources at the local level, and in some instances say they increase, you know, tax levies, that we don't have any insight into what's required of them in terms of meeting the needs of their local members. And we really want to collaborate with them on understanding the whole picture in terms of how the human services system is administered. So yes, we know the functions and we know the requirements, but we aren't involved in how local governments are financing their staffing.
Senator Pratt.
Thank you, Mr. Chair. Well, you know, as we've seen from deputy commissioner / interim commissioner / commissioner / deputy commissioner / temporary commissioner Gandhi, that's quite a track record. The reason for this bill is that we've had a lack of leadership, a lack of oversight in DHS, and now we're trying to, you know, bail them out with a $2 million study for things that, at least from my perspective in the private sector, my perspective in going in and taking over teams and restructuring them this is something they should have already been doing, and quite honestly should have oversight in a lot of these areas. I can understand that maybe we want to collect some external data. We want to look at some best practices. I've hired consultants to do this work for a lot less money than this. For what the deputy commissioner has suggested, and I think it goes to show that we've had a lack of intentional leadership on this fraud. Why the leadership at DHS has been denying that there's been fraud for many months, and I'm not going to belabor this point anymore. I just think it needed to be called out.
I'm glad you did.
From that perspective.
Mr. Chair,
Senator Wickland.
I'd just like to say, I'd like to add, I mean, the counties are really asking for more of a reassessment. And what maybe wasn't mentioned is that counties already have to interact directly with the federal government in certain respects. And we need to understand better how that is affecting their ability to provide services as well. So this isn't just a matter of the current agency is providing oversight and they should have the information. This is a complex, I don't know, there are tons of human services systems that are involved, and there are huge responsibilities that the counties are facing. They're facing increased responsibilities due to federal HR 1, and to have clarity on how to provide services to people efficiently is going to take significant effort to understand. And find a way to move forward without impacting Minnesotans in a negative way. So I think it is worthwhile to do this work, and it is very necessary at this time.
Given the increasing complexity what the counties are being asked to do now from the new federal requirements, I think I'm hearing the counties screaming about we need help. And I think they're very interested in this study. That's my take on it. Senator Mohammed.
Mr. Chair, you said that well, but this is an independent third party to analyze existing human services programs. This is a massive, massive agency that there's so many other parts that are a part of the issue, and whether it's the counties, MCOs, this is a huge, huge agency, and I think having a third independent body study the human services and programs, I think would only help both the counties and the agency, so we can understand where the problems are.
Further discussion. Senator Hoffman looks like he wants to say something.
I always want to say something. Mr. Chair, last year, the Human Services Committee actually helped the counties. The cuts that were being proposed were going to be on the backs of counties to pay for, right? And we, our Human Services Committee, we know that, you know, most states, when you see one Medicaid plan in a state, you've seen one Medicaid plan in a state, right? Well, you said it, and I agree with you, Senator Marty. It's counties, county, county. That's what it's been in Minnesota, to our benefit, but also there's some gaps. When you look at Beltrami, or you look at Todd, or you look at some of these other counties where 75% of their land is public land, we have an issue, right? We put together last year the long-term care savings. There's some counties and the DWRS folks, along with the state. This conversation should be already happening and be part of that. Senator Pratt has highlighted something that I have grave concerns about. I'm being told, and you didn't give me a dollar amount, but I'm hearing through the grapevine, the numbers are 6 figures in the millions about trying to find savings. Folks, we have 65% of our population, 65 and older, is a larger, 1.3 million people. That's larger than our K-12 education. Senator Pratt and I were both on school boards, although the one I served on, it was larger than his, but he was the chair. And that's, Melissa Wickland was the chair of Bloomington. There was a lot of us who did what we do. But in this case, in the human services arena, Mr. Chair, I really think this bill needs to be vetted again, which was what we've been doing. We've had so many eyes on it. We've had so many people doing it. But this has been a great conversation, because this conversation today has highlighted where I still see some gaps that we need to discuss and pull out. And so I'm glad this is going to judiciary. There's some great work in here, and I think it's worthy of us moving forward, but keep on working on that, Mr. Chair. And I just want to highlight again, the counties, the committee that I'm chair of, we actually last year we were tax cuts to the counties on this, and I'll never forget that. But that was not easy work to do. The system, like Senator Wickland says, is very complex. Senator Marty, you've been around a long time. This system was set up even long before you were coming in here. And if you're really going to do it, 4 years ago, I told the governor, go talk to Alan Bergman, probably one of the smartest people I know. I actually made a comment in a public meeting one time. I said, he's the smartest person I know when it comes to Medicaid. He corrected me in front of a bunch of people. He said, I am not the smartest, but I am in the top 3. You need somebody like that who understands how systems work inside and out, right? Instead, Senator, we see the system needing some support on that. I agree with them needing support of a third party, but it's got to be the right person. And the system's got to be ready to change, because it's complex, like Senator Wickland says. We're taking some hard looks at it, but I appreciate the conversation here today, Mr. Chair.
Further discussion on the bill. Senator, no, she already spoke, I guess. Further discussion on the bill. And to be clear, Senator Wickland's motion is that this bill is going to the floor, and that the Judiciary Committee is meeting on, we believe, Monday, to look over the provisions in it that they have not already
It's
seen.
not ready for the
Yes.
floor.
Mr. Chair, the judiciary hearing is, what I've heard is Monday.
Okay, thank you. Senator Wickland moves Senate file, House File 3379 as amended be recommended pass. Staff be instructed to make technical and conforming changes. On that motion, further discussion, final statements?
Mr. Chair, I don't think it's ready for the floor. It is not ready for the floor. I think it's based on the conversations of Senator Pratt and Senator Wickland. So if you two are going to work on the provisions that need to be worked on, I would consider laying this thing on the table and then bringing it back up to get the fixes. And I'm not going to let political pressures push us, because we have integrity work in our other on our other bills as well, Senator Marty. But I think this bill, as it sits, is not ready for the floor. It's going to be chock full of amendments coming up, and I'm going to tell you that right now. And since it is my House file, I just need the commitment that Senator Pratt and Senator Wickland, if you're going to move it to the floor, I'm telling you, it's not ready for. There's some doubt. You guys have created some doubt in some things in the system here. So, but again,
In that case, what I'm going to suggest is we take a brief recess and discuss the plan for the bill, because we are now down to a week, roughly speaking, give or take a few days. But I want to make sure we have a chance to get a good package through.
Yep.
Want to make sure people are comfortable with that. So I'm going to suggest we recess to the call of the chair and discuss direction for the bill.
sounds good.
Senator Pratt,
Is that discussion going to happen right now and we'll come back in a couple of minutes?
I
I think we have, a lot of us have
I wish I could
appointments.
tell you, I guess let's try for 15 minutes. With that, the committee's in recess, the call of the chair. Good morning still. The Senate Finance Committee will come back to order. And I think if the authors are here. We were discussing path for the bill, and I will comment the way I understand it, and both of you can comment more as well. And that is that we would now move, Senator Wickland did move House File 3379, move to the floor. And in terms of the study here, the cost for analyzing how the counties and the state, what should be done by counties and state and so on, that one is still going to be under discussion and can be removed on the floor if the author desires. But we will have more discussion on that. And that also, Senator Wickland, you said Judiciary is going to convene on Monday to address the parts they haven't looked at yet.
Mr. Chair, that's correct. We will bring the items that haven't been reviewed by the Judiciary Committee to that committee on Monday. I will continue to work with Senator Pratt on the amendment that we adopted today. And I will continue to work on if there are provisions like the study that need to be reassessed. And I'm happy to reassess the cost and value of that provision to see if it makes sense to keep that in the bill, and happy to make a decision on that on the floor. So I would be happy to continue doing that work.
Thank you. And Senator Hoffman.
Mr. Chair and members, thank you. Since the very beginning of this session, which should have started in January, not the end of February, just thank you, Sandy Pappas, for agreeing to that. I don't know why we do that. Continuity of care has been the committee that I chair's #1 concern all year. And we just want to make sure that the decisions that are being made by the administration decisions that are being made by the department, decisions that we are making, have that as a filter. And I shared with you a judge's order that is pretty sad to read, Mr. Chair. And I want to make sure that this committee understands that my primary filter is going to be the continuity of care for the most vulnerable people in the state of Minnesota. And those are my concerns that came out. I trust Senator Wickland to work with the folks that need to be worked on it, because she forgets more in a day in this human services world than I'll ever know. So with that, do what you need to do. I appreciate your time.
Thank you. Is there further discussion on the bill? If not, Senator Wickland has moved that House File 3379 as amended be recommended pass, and staff be instructed to make technical and conforming changes. On that motion, all those in favor say aye.
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 Opposed? Motion prevails. Senators Hoffman and Wickland and all the SCRFA staff and your committee staff and everybody else involved in this has been a huge undertaking, and we're not finished yet, but I appreciate the work of this committee today. And with that, this committee, well, we are meeting. Senator Pratt.
Thank you, Mr. Chair. And again, can you give us a sense of what we're going to be doing on Monday then?
Yes. Next week, we're going to be meeting at Monday at 8:30 a.m. And I believe the bills I'm aware of is Senator Seeberger has a survivor benefits of expansion for public safety officers. Senator McQuaid has her anti-grooming bill, and Senator Johnson Stewart e-bike regulation, and Senator Francis pension bill are all in front of this committee on Monday. And as far as I know, that I hope that's the last meeting. With that, this committee is adjourned.